and good evening. Today's video will be kind of a continuation of my last video talking about relationship dynamics and attachment styles. And I want to build upon that and talk about how mental health issues can manifest into these different types of relationship dynamics so that more people are aware that the challenges that they face in relationships could be due to an underlying medical health condition that isn't diagnosed yet. Not everybody is aware that these issues exist, and it can help to understand why some people operate in different ways that can sometimes self-sabotage a relationship. There is a correlation of mental health issues manifesting symptoms that include toxic relationship dynamics and unhealthy behaviors. I am, of course, not encouraging that we diagnose people that were not qualified to do so. However, if you're experiencing issues in relationships to a more extreme level with yourself or another person, it could be related to a deeper mental health issue. People are often scared to go to therapy or a psychiatrist because they don't want to feel like something's wrong with them or they don't think anything's wrong with them. So I want to bring attention to these symptoms and patterns because I feel like this affects a lot of people. I spent a lot of my time being very confused at certain people's behaviors in relationships, and then I learned more about less commonly known mental health issues, and people's behaviors made more sense. My motivation was trying to understand people on a more deeper level in order to be able to interact with them better and not take their behaviors personally. So then if you think someone is struggling with a mental health issue, you can try and encourage them to seek therapy. Awareness is the first step in healing. The thing with mental health issues is they reflect an issue of internal processes and dysregulation that then manifest in outward symptoms. Any type of mental health problem does and often causes issues with relationships. I think most people have heard of anxiety, depression, OCD, which is obsessive compulsive disorder, bipolar, or schizophrenia. Some lesser known mental health issues that I'd like to go more in depth about today are narcissism, BPD, which is borderline personality disorder, and CPTSD, which is complex post-traumatic stress disorder. CPTSD isn't actually classified in the DSM-5 as an actual diagnosis. It's classified as like a sub-diagnosis of PTSD, but the World Health Organization, the WHO, recognizes it as its own diagnosis. Narcissism has begun to grow more in awareness in the public in recent years, but I do think a lot of people overuse the term narcissist. The statistic of how many people actually have narcissism varies. Some studies think it's 1 to 2% of the population, some think it's 6, or sometimes even up to 20%. It is difficult to pinpoint because narcissists are less likely to seek out help because they don't think anything is really wrong with their behavior, and so it's kind of hard to determine an exact statistic. There are different categories of narcissism, and it also exists on a spectrum. You can have it mildly, moderately, or severely. A person can demonstrate narcissistic characteristics but not actually qualify for narcissistic personality disorder. Narcissism, BPD, and CPTSD have some overlapping symptoms, and I think that's why so many people are quick to throw around the term narcissist when it really may be a difficult issue going on. This can also lead people to getting misdiagnosed. All of these conditions often stem from childhood trauma, which results in emotional dysregulation, low self-esteem, and problems in relationships. They may display similar symptoms, but the reasoning behind it is different. This matters when recognizing whether or not certain issues can be worked through or not. Sometimes they aren't open to changing. Trauma will change how your brain operates and functions. People with these conditions can't help how their brain has responded to certain traumatic events, but they can work to try and improve the symptoms if that's something that they're interested in doing. Because of course it is a personal choice if people want to change or not. So what is a toxic relationship? Toxic relationships typically include elements of manipulation, controlling behavior, a lack of support, which can lead to feelings of low self-worth, self-esteem, insecurity, or distress. These relationships are damaging to your mental, emotional, and sometimes physical health. These people will try to control your life choices, such as how you dress, what you can and can't do. They may constantly criticize you, belittle you, or insult you. There's gaslighting, which is them trying to convince you that your own reality and experience is distorted. There's dishonesty and betrayal, attempts to isolate you from your friends and family, feeling unsupported or constantly ignored, blame shifting, where they try to make everything seem like it's your fault, and verbal and emotional abuse. I would say often mental health issues contribute to these toxic relationship dynamics. Even just having anxiety can cause people to act in a controlling way because of their own feelings of insecurity, and then they try to project it onto the other person. They're worried about their partner going out without them because they're worried that someone else might hit on them, so they might make the other person dress a certain way or have restrictions on when they have to be back, where they can go, or they won't let them go at all. And sometimes they don't explicitly say, you can't do this, you can't do that, but they will make it very difficult, and they will act very mad at you if you try to go out, and they'll try to manipulate you, they'll try to start a fight right when you're supposed to leave. With certain mental health conditions, these toxic relationship dynamics can get even more intense. I think it's important to consider when getting into a relationship with someone the extent of their mental health issues and severity, as most mental health issues exist on a spectrum. I think if a person has mental health issues and they want to be in a relationship, then they should be open to going to therapy or working on managing their symptoms. Otherwise, this is when people can venture into acting in toxic ways. People who don't have a secure attachment style aren't always toxic. It is possible to have an avoidant type of attachment style and anxious attachment style and not be toxic. I think it's important to consider that if someone is behaving in these toxic ways, that you should consider if there's some sort of underlying mental health issue that's contributing to these toxic behaviors. Oftentimes there is, and we can't diagnose them unless we're qualified, but there are some patterns that we can pay attention to and then try to get this person to seek professional help, especially if this behavior is severely affecting their life and their relationships. It can be very difficult sometimes when you're involved in a toxic relationship to really see it for what it is, because when you're submerged in something, it can be difficult to take a step back and really look at it from a separate perspective. Some people are walking around with undiagnosed mental health issues, and some of the symptoms include toxic relationship dynamics. A lot of these people think that their behavior is normal or justified, and they don't think it's a problem at all. They don't even realize. But I think some of them are aware that their behavior is a little toxic, and they just don't care. When people become toxic, they can be very manipulative and can convince you that all of the things that they are doing to you are your fault. So that's why it's important to be aware of these dynamics and mental health issues before stumbling into a connection like that and getting sucked into their distortions. But sometimes people really have to learn the hard way, where they don't see it and they just have to experience it in order to learn. And that's okay. Hopefully after we've learned the lesson once, we can learn it and not repeat it again and not have relationships with the same person in different bodies. Let's review this chart again. This is the chart I had made in my other video where it has this spectrum of attachment styles and relationship dynamics, where it starts with avoidant attachment, it goes to secure, then we have anxious attached, we have disorganized attachment above the center, and then continuing to the right we have codependency and a group I call stubborn people. I'll be referencing some of the stuff I talked about in the last video relating to this chart, so I just wanted to show it again. Toxic relationships often include power dynamics and manipulation. In this type of relationship where there's power dynamics, one person normally has all of the power and the other person is kind of giving their power away to them. It's not a mutual give and take. In this situation, there is someone who is overpowering or manipulative or intimidating or all the above, and that's kind of how they keep a sense of control over this other person. There can be this awareness of the toxicity in the relationship, but they still stay with this person. What I think needs to happen in these relationships, and what I think happens at some point, is that the person who's giving their power away needs to choose themselves, which normally means to walk away and cut contact with this person, or at least set boundaries with them to try and balance out the connection. But a lot of times this is very difficult because people who like having this power over others, they're not going to give it up very easily. It's very difficult sometimes to walk away from a connection like this because there is this element of feeling like you're in an emotional or mental prison. A lot of times people do recognize that their relationship is unhealthy, but it can be very difficult to break out of it, especially if your self-worth is now tied to this relationship and how this other person feels about you. Some people who exhibit these characteristics can have BPD, narcissism, or complex PTSD. Sometimes people like this also have more than one diagnosis where they will have BPD and narcissism. When this goes undiagnosed and both people aren't aware, it can create very difficult and confusing circumstances. When narcissism is caused by childhood trauma, which it is a lot of times, then it also is considered CPTSD. However, not everybody who has CPTSD ends up being a narcissist. This is why it's important to get people to go to doctors. If they care about the relationship with you, then they will be more open to seeing a psychiatrist or a therapist to talk about their issues and to try and work through where it's coming from and what maybe they could improve upon. If they aren't open to going to therapy or working on themselves at all, then it probably would be better to walk away from this connection. Being with someone like that often causes the other person a lot of trauma dealing with it, and you don't want to keep taking on that trauma just because you love this person. There can be this push and pull in the relationship. You do something maybe they don't like, there's silent treatment and ignoring to punish you, or there is rage and this controlling element that is projected onto you. This to me is like an intense version of disorganized attachment style, but the motive here is to manipulate and maintain control. Narcissists can embody both sides of the spectrum of attachment styles. It would depend on the type of narcissist they are. So characteristics of BPD, borderline personality disorder, generally are, most importantly, a major fear of abandonment, intense mood swings, intense anger, and turbulent relationships. There are different types of BPD, and so not all these symptoms are going to present the same. And once again, we want to remember that BPD is caused by trauma, and as a result of trauma. The way their brain works is inherently different. They have a distorted and unstable sense of self, often like narcissists and people with CPTSD. They can display impulsive behaviors, self-harm, disassociation, paranoia, and a black and white thinking pattern where you're either essentially with them or against them. There's no gray area. They too embody these characteristics when reflecting on themselves. So they can often be very hard on themselves when they make a mistake and they don't show themselves that compassion. So it's hard for them to show it to other people. I think it's very important to consider being in their shoes, where they've experienced such chaos, normally as a child, and now their brain has changed to the point where they feel like this is how they need to act in order to navigate the world and protect themselves. This major fear of abandonment causes them to embody the disorganized attachment style. This is the push and pull of need and fear. Oftentimes, if there is a conflict with another person, it can be very difficult to work through. They're the type to jump to extreme anger and the extremes of like, okay, well, why don't I just leave then? And this can cause the person to rapidly enter and exit relationships. There can also be this feeling that they're being a burden because of these intense feelings, that they have a hard time controlling their reactions, and so they hurt the people they love. This intense anger can be brought upon by something very minor, and then they might be plagued with feelings of guilt or shame about it. That's why it's estimated approximately 70% of people with BPD will attempt suicide at some point, and 80% experiencing suicidal ideation. And 8 to 10% of people with BPD will end up committing suicide at some point in their life, which is the highest amount of any of the psychiatric conditions. These people can often view something that was said in a neutral way as negative, attacking, or insulting. If you try to rectify the conflict with them in this moment, they're often not able to due to the intense anger. It's hard to consider other perspectives when your own feelings are very intense. These challenges often cause turbulent relationships as there is deep intimacy issues going on. Resolving conflict is very uncomfortable for them. And it's because when they experienced conflict as a child, it probably was never resolved in a healthy way. They say there can be a difference of expression depending on if a man or a woman has BPD, and men are more likely to externalize their distress with impulsivity and explosive temperaments, while women are more likely to internalize it through depression, anxiety, or self-harm, but really it can go either way. They can also play mind games, and they will push you away to see if you come back. And if you don't come back, then it's this own justification to themselves like, oh, I was right about you. Because if you really cared about me, then you would still be interested in me even though I pushed you away. So my fears are correct that you are a bad person. And when they've finally pushed the other person away, they will get this internal fear confirmed that they will always get abandoned and rejected. It is this self-fulfilling prophecy and self-sabotage. Once they've pushed you far enough away and they realize you're not coming back, then they can switch and get really scared. They realize that they don't want to lose this person and that they'll change and they're sorry. And they'll say it's not going to happen again, but the cycle tends to continue unless they actually are putting in the work or going to therapy to change this. But even then, rewiring your brain can be very difficult. There is a difference between narcissism and narcissistic personality disorder. Narcissist is more of a broad term to include any type of narcissistic behavior, while NPD is the actual diagnosis that has more of a stricter criteria. Narcissism, like I said earlier, exists on a spectrum, so you can have mild, moderate, or extreme symptoms. There are also several different types of narcissism, and so these symptoms will present in different ways. Dr. Ramani says that there are 8 types of narcissism. There's grandiose, then there's covert/vulnerable narcissist, malignant, communal, benign, neglectful, entitled or self-righteous, and generational or cultural. I'm not going to go too in-depth into all of them, but I just want to mention that there are multiple types. Generally, narcissists tend to have a very fragile ego and low self-esteem, although they may not show it often. It is the foundation for why they tend to engage in behaviors that seemingly lack empathy, that are antisocial, dependent on external validation, and portraying a sense of grandiosity. Depending on the type, they will go about it in different ways. A grandiose narcissist tends to be more outwardly arrogant, attention-seeking, entitled, and thinks of themselves extremely superior to everyone or most people. While a covert narcissist will act in ways that portray themselves as the victim in order to gain pity and sympathy. They have such a fragile sense of self and deep insecurity, and that's what causes them to seek this external validation from other people. It's like they have 2 wolves inside of them, and in order to balance out this really insecure wolf inside of them, they have to create this character of grandiosity to kind of silence that. They're trying to rectify their internal issues by external means instead of doing inner work on themselves. They are normally disconnected consciously from that side to them, so it shows up in their behavior. By putting up this wall, it often disconnects them from the empathetic side of them, as they need to keep up that wall by any means necessary, and the people around them are collateral. They have to try and make everyone around them validate their importance because they are lacking it inside, and they consciously don't realize that's what's going on. When they don't get it, or they don't get it in the way they want, or the amount they want, they're going to lash out in order to maintain control and receive that validation because they do not have a strong sense of confidence and internal security to deal with life. Narcissistic people will take it personally if you are simply minding your own business. If you are not going out of their way to do something for them, then they take it as a personal attack and will respond as so. There seems to be this perception with narcissism that they're people that are just bad or evil, and they do these bad things because they just suck. But really, people with narcissistic personality disorder have a very fragile sense of self. And as a result of this, they can act in very toxic and problematic ways. but the outward expression are just the symptoms. You don't have to be a narcissist to be abusive. The real problem with the illness lies in their own distorted perception of themselves. Their self-image and internal processes are so out of whack that they need this external validation in order to be okay with themselves. This dysregulation affects their emotions, thinking processes, and ability to feel and express empathy. As a result of this, they build a wall within themselves to protect themselves from their own insecurity. Because narcissism is an internal issue, it technically can be addressed and treated. But it does take a lot of work because the narcissist has spent a lot of time and energy creating this wall within them to keep back this insecurity and view of themselves. It's kind of like this cognitive dissonance where they're purposely pushing away and projecting that grandiosity. A lot more extreme narcissists will not be open to going to therapy. So now let's talk about CPTSD, which is different from PTSD. PTSD stands for post-traumatic stress disorder, and it typically comes from a singular event that was traumatizing to the individual. While CPTSD, and the C stands for complex, is repeated trauma over a period of time that has changed the way the brain operates and processes information. This is typically from childhood, but it doesn't have to be. But when it is, this is childhood trauma of any kind. The symptoms include difficulties with emotional regulation, self-perception, relationships, and will often experience feelings of worthlessness, emotional numbness, or intense anger. The trauma can be more obvious, like verbal, sexual, or physical abuse, but it can also come across in more subtle ways. It does not take much for the neural pathways to start to adapt to neglect, abandonment, or repeated events of rejection. It's going to be different for different people because some people are more sensitive to this kind of rejection. This is why sometimes people think that they had a happy childhood because there wasn't any outward, clear signs of abuse, but that's because it's more complex than that. They don't recognize how certain repeated patterns can also contribute to trauma, especially due to cultural or societal norms. A lot of people feel that it's normal to hit children when they misbehave, or it's normal for siblings to fight, or it's normal for an older sibling to pick on their younger siblings. But a lot of times it is abusive and traumatizing, especially when repeated over years. This repeated abuse and trauma alters how the person feels about themselves. To be a part of a family dynamic where you are picked on often for no reason or for just being yourself. Growing up, these children can become the people that rely on others for external validation and approval. As when they were younger, it was important for survival for them to have other people like them. If people in your family didn't like how you were acting, they were gonna beat you up, they were gonna call you names. If people don't like you as an adult, it can be triggering as it reminds you of your childhood. This is where some people take their trauma and block it away and they turn into narcissists, forcing an environment around them where people have to like them or they will be exiled or manipulated. But then sometimes they experience this childhood trauma and they tend to linger in this feeling of insecurity, shame, and self-sabotage. On the outside, narcissism and CPTSD can look similar as they both can appear to be very self-focused. But a narcissist's reasoning is because they feel like they're very important and everyone must validate that. Whereas CPTSD is self-focused because they're worried that people won't like them. They can act very insecure and fearful and are afraid to take up space. This can often cause a feeling of being very misunderstood. A lot of people will see this as self-centered behavior when really it's because their internal world is very overwhelming and they can't help be overly focused on that. That really is the foundation of mental illness, is that your internal processes are so overwhelming that it affects your outward function and behavior. It does take deeper awareness and emotional intelligence to be able to decipher the difference. Being so focused on how you feel inside can cause you to not take into account how others are feeling. On the surface, it seems to be a lack of empathy, a similar symptom to narcissism, but the reasoning behind it is different. Both are often very sensitive to criticism and cannot tolerate any discussions in which they are perceived negatively because of past trauma. There can also be this victim complex where they're blaming everyone else for their problems, and the pain becomes a part of their identity. So let's say we have someone who experienced childhood trauma, neglect, or had parents that weren't the greatest, and they did not teach them healthy emotional regulation or conflict resolution. They grow up, they turn 18, they move out. Maybe they move far away, maybe they go to college, but oftentimes they don't really have the best emotional intelligence unless they have a more naturally innate understanding of the dysfunction they experienced. This might be more common now with the availability of the internet, since more information is readily available. There can be more awareness to what a healthy relationship is. But let's say they didn't, okay? They didn't do that. Do we think this person is going to be very emotionally mature? Probably not. My point is that youth is a factor when analyzing people's behavior. And this is common sense sometimes, but this is where I think people get lost, and they might see someone acting like this and think, oh my god, there must be a narcissist, when really they were just never parented very well. It's a mixture of people trying to deal with their trauma, but some people not even realizing that they have trauma or how it's affecting them. CPTSD can be outwardly moody and struggle with anger, and can be extremely reactive and controlling about certain things, similar to BPD. CPTSD often ends up having a disorganized attachment style. That's why it's a common correlation to assume if someone has a disorganized attachment style, then they have CPTSD. But also, as we said, BPD tends to have disorganized attachment style. The thing about CPTSD and BPD is that typically in the moment, they don't think that they're wrong, and they don't think that their reactions to what's going on are wrong. They think that you have wronged them somehow, and that their reaction is normal or justified, especially if you have hurt them in their eyes. But really, they are hypersensitive to things. They might be taking things the wrong way. They might interpret neutral statements as something that's bad, and so they're going to lash out, and they feel like it's justified because of their own perception. And that's not because they're bad people. It's because of this internal distortion of how they're perceiving you and the world around them. Because these people can get so overwhelmed with their own feelings, they can end up disregarding others' feelings and experiences. Sometimes afterwards they might feel bad, but sometimes they don't for a little bit. It sometimes takes time to be honest with oneself to get to that conclusion. In a few of Dr. Ramani's videos, she had said that she didn't think that BPD and narcissism should actually be classified as a disorder. And she didn't say why in the videos I watched where she said that, but I think it's an interesting take. And I've thought about this before, that there is some box of personality that people are supposed to fit in. And if you don't fit in that box, then you must have a disorder. And it kind of reminds me of back in the day, if you were a woman and you were being difficult or having feelings, then they said you had female hysteria and it was a problem and they had to fix it. But I do think the point of having these diagnoses is to be able to form a treatment plan for what the patient is experiencing. But then I think this creates a new problem where this person may take on this diagnosis and have it become part of their identity. And they can latch on to labels. And I think sometimes it can interfere with them trying to get better. Because these types of conditions typically develop because of an abusive or neglectful childhood, there can be this feeling bad for this person and simply not wanting to break it off with them because you know that they're like this because of the hard things that they have been through. But there is a line in the sand that if someone is continuously abusive or toxic and it's really taking a toll on your well-being, it's important to consider if you would be better off with them not in your life anymore. You cannot pour from an empty cup, and if they're taking too much from you and not replenishing it, then you're doing yourself a disservice. It is kind to be compassionate, but if you're so compassionate to the point where it's to the expense of yourself, then that relationship is not sustainable. And you will hit a breaking point if this person is not willing to work on themselves or work on the relationship. In these types of connections, it is important to choose yourself. Especially because narcissistic people tend to like empathetic people, so they can kind of take advantage of them and their kindness and use them as a supply source. This is important to keep in mind because sometimes people are not going to a psychiatrist or a psychologist, and sometimes people are not honest with themselves. Some people don't think that they have a problem. Some people think that they're fine and that nothing's wrong with them and that how they behave is perfectly normal. And it can be hard like this for people to seek any professional help or opinions. So that's when it comes to, as an individual dealing with people like this, to make their own personal assessment. Not diagnose, but to recognize patterns. Narcissistic people and people with BPD might be less likely to be open to seeking help, while people with CPTSD might be a little more open to it, but some of them aren't, or they don't have the interest to, and that's okay. It's just deciding if you can continue interacting with or having relationships with people who are unable to change. That's where it comes to a point where it doesn't matter what type of mental health issue someone's struggling with. If they're unable to work on themselves or try to change and put effort into treating people better, then the answer would be to distance yourself from these people, to put up boundaries, or to completely cut contact with them in order for your own sanity and protection of oneself. You can't really set a boundary with narcissistic people. They don't really listen. So if you have to deal with someone who's narcissistic, who's like in your family or an ex-spouse, ex-partner that you have to keep interacting with, you can't cut contact for some reason, then there has to be this acceptance that they're not going to change. And you have to just not take their behavior personally. You have to try not to get sucked into their game. And that's where it becomes important to work on yourself and be sure of yourself, to be able to stand against people that are trying to gaslight or manipulate you. Narcissists view boundaries as inconsiderate, lacking empathy, or they take it as a personal attack. This is especially relevant if you have a narcissistic parent who felt very entitled to know everything about you growing up and still does. And so if there's a narcissistic person who grew up in a narcissistic family dynamic, they're going to have no concept of boundaries at all. They really do project all the time, and they will be the ones who are self-centered and lashing out at you for setting a boundary in a completely healthy way. And that's why it's such a crazy experience to be stuck in a narcissistic relationship. They point the finger at you for everything that they're doing. So that is all I have for you today. Thank you so much for watching my video. My name is Lily. Stay frosty. Bye-bye.